Hi YouTube, welcome back. This is going to be part 2 of dry eye. We're going to be talking about the different subsets of dry eye and then a few treatment options that you can add on to the behavioral changes that we talked about last month. So one subset of dry eye, it's called aqueous deficient dry eye. It's exactly what it sounds like. This is a failure or a reduction in the production and secretion of tears. The tear film has a couple different layers. It's now said that it's mainly a mixture of different proteins, different lipids, different water particles. So the aqueous deficient part is talking about the water portion of the tears. When there isn't enough, then your tear volume is very low. You can start having the symptoms that we talked about last time. A couple different causes of this. So there is an autoimmune disease called Sjogren's. This is an autoimmune disease that targets specific glands, and some of the glands that are affected are your lacrimal glands, which help produce your tears. So that could be something that causes this. There's also age-related dry eye, where just with time and age, your lacrimal glands don't work as well as they used to. So there's a deficiency in that, and then that would end up having you to have less tear volume. If there's anything that's obstructing the gland, then that could also be a cause. And then the medications that we talked about, any type of allergy medications, diuretics, and like beta blockers for high blood pressure, those can also cause to reduce your tear production. The other subset of dry eye is called evaporative dry eye. So this is when your tears end up evaporating too fast. Your eyes are either open too long, you're not blinking enough, so then when it's not replenished on a regular basis, they end up evaporating, and then you can have the symptoms of dry eye. On our eyelids, we do have glands on the top and the bottom that help produce an oil layer of the tears. The oils in your tears help to prevent the tears from evaporating too fast. When those glands end up getting too clogged, if they are blocked up, then they're not releasing the oils for your tears. And whenever you're not blinking enough, if there are any sorts of lid abnormalities, that can also affect your blink rates. And then any type of topical medication, so like glaucoma, eye drops, things like that have a lot of preservatives. If you end up having to use it for a really long time, those preservatives end up having an adverse effect. So those are the things that could end up affecting evaporative dry eye. Some of the treatments that we can do, there's a lot. I'm going to go through some of them. These can apply to either one, but tear replacement, meaning that you can just get artificial tears. There are certain types that you can get over the counter, certain types that are prescribed, but artificial tears are basically just to help replace and supplement the natural tear film. They do have a couple different options. You have tears or like solutions, which are the looser ones that are typically the best during the day. They do have a gel formulation, which is a little bit thicker. When they are thicker, they stay on your eye longer, so it should theoretically give you more relief. There are also ointments that help. Ointments are the best for at night because they do tend to blur your vision a little bit. So during the day, it's still thick enough to stay on longer, but it just gives you some of that blurring effect, so most people like using it at night. Lid hygiene is definitely something that is recommended. On our eyelashes, we do have a natural bacteria load. If there ends up being a lot, you end up having a lot of byproducts, and then those byproducts can cause inflammation into the eye. So lid hygiene, there are a lot of scrubs, wipes, and foams that are good to target that area. So whenever you're washing your face, also target that area around your eyelashes and your lid margin. Warm compresses are whenever you have either like a mask that has beads in them, you can put it in the microwave that would heat up the beads, and those are warm compresses. It helps to soften the glands that are producing the oils. Whenever it softens it up, hopefully then it'll kind of release, and then more of your oils would get secreted into your tear film. This goes in addition to any type of longer heat treatment for the eyes. If you have a longer one that stays hot for a while, those are the best. And then it goes in addition to gland expression, which is basically whenever you come into the doctor, when we heat up your glands and then we manually express all of the clogged up glands out, and that would basically just allow the glands to become more functional, and then we take out and remove any of the obstruction. After that, whenever we whenever we remove them, we do want to replace it with good oils. So omega-3 fatty acids, those are something that are good, that are anti-inflammatory. And then now whenever we remove those obstructions, we're replacing it with good oils, and then hopefully that would stay and be better for your tear film. After that, there are more, I would say, different options. Now, these are just things that you would definitely have to come in here for, or to your local doctor for. There's tear conservation, where we do have a drainage system on our eyelids, and we would basically plug those up so that whenever you are producing tears, it's not draining, so then they end up staying on your eye longer. And then there are also moisture chamber spectacles. Basically, they are kind of like goggles where they minimize the airflow, so then you don't have as much airflow. And then the other thing that we can do, there are certain contact lenses that do help. There are soft bandage contact lenses, which basically help if there's any sort of scratches on the eye. We basically allow your epithelium, which is the front surface of the eye, to heal, and then we take those off, and then hopefully you have a better surface for your tears to go over. Or scleral lenses, these are the big contact, hard contact lenses, but basically the ways that those help is there is a collection of tears between the contact lens and your eye, and basically that reservoir of tears basically helps with the tear film. But these are some of the treatment options. There are definitely a lot more, but whenever you go to see your local optometrist, it is definitely something that we will have to do on an individual basis. Not everything is going to be exactly the same, but we'll figure it out. We'll hear you out. We know this is definitely something that is difficult to deal with, but we'll try our best. All right, thank you.